Hello, good morning, good afternoon. Welcome, everyone. Thank you for joining us today on Facebook Live. We are honored here at Carnegie Science Center to be joined by Dr. Peter Hotez. Peter Hotez, MD, PhD, is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he's also the co-director of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. Dr. Hotez, thank you. Welcome.
Oh, thanks so much for having me.
So today's conversation, we are going to discuss some of the latest developments in the COVID-19 pandemic, especially as they relate to the Delta variant. And we'll also hope to gain some of your insights. But for now, if you wouldn't mind taking it away, I understand you have some slides and you'll share some information with us.
Yeah, let me talk for about 20 minutes, Brad, and then we'll just to make some general comments about where I think things are going, and then open it up to questions, however you'd like to proceed. But thanks so much for inviting me. Obviously, a deep admiration for the Carnegie Center and its mission. And the reason I got to know Pittsburgh a little bit, I had two college roommates from Pittsburgh, so so I got to know the city a little bit, and it's just one of my favorite American cities, and it's such a rich place culturally, and the people are wonderful. And I wish I could be here in person with you, but post-apocalypse we'll do that. I promise.
No,
But
we
let me
look forward to it.
Absolutely. So let's kind of go through some of the high points, and both with respect to the science and unfortunately with respect to the anti-science. So just a word who I am. I'm a vaccine scientist, pediatric scientist, an MD, PhD, laboratory investigator, develops vaccines. I'm a professor and dean at Baylor College of Medicine, and our pediatrics department's based at Texas Children's Hospital, which is one of the great children's hospitals, like Children's Hospital of Pittsburgh. And our vaccine center is called the Texas Children's Center for Vaccine Development, where we make vaccines for neglected diseases. And it's co-headed by myself and my science partner for the last 20 years, Dr. Mary Elena Batazzi. And we've been mainly focused on parasitic disease vaccines. And but around a decade ago, because coronavirus vaccines were orphaned, just like our parasitic disease vaccines, we make the vaccines the pharma companies won't make. We took it on because nobody cared about coronavirus vaccines 10 years ago, and we made SARS and MERS vaccines showing how you can deliver the spike protein and induce an immune response to it and why that's protective. And all that work led to the COVID-19 vaccines. And now we have our own COVID-19 vaccine that's being accelerated for low and middle income countries. And I'll speak a little bit about that as well. Obviously, Delta's on everybody's mind. This is really taking off. It first accelerated in India and then the UK, and now it's the overwhelming dominant variant of concern here in the United States. We're looking at 80-90% of all of the cases now linked to Delta, and it's highly transmissible, and pretty much anyone who's unvaccinated at this point is at high risk of getting infection. And unfortunately, we're seeing a lot of young people now getting into hospitals. And here in Houston, we're in a pretty dire situation. We've now created a tent city in Houston for all of the COVID cases. Different flavor because we're not seeing as many older people because they are vaccinated. It's all the young people. That's where the vaccination rates really fall off, is among young people here in the South compared to the North, where there's much higher vaccination rates. So we're looking at maybe 20-25% of adolescents, young adults vaccinated in here in Houston, in the southern part of the country. And that's what's being so devastating. The good news is the vaccines appear to be working pretty well against the Delta variant compared to Alpha, which is the B.1.1.7 variant for the UK, at least versus symptomatic infection. And there's a little bit of discrepancies, and I've written about this now in the Daily Beast, trying to understand the differences. So it looks as though, based on a New England Journal of Medicine paper that showed pretty high levels of efficacy, still 88% against Delta in terms of symptomatic illness. But a couple of studies in Israel now have shown lower, and trying to understand that discrepancy. And I think one of the big confusions is there truly a decline in immunity after 6 months, or is it because it's the Delta variant that the level of virus neutralizing antibodies versus Delta are not as high? And I think that's what needs to be sorted out in terms of whether or not we recommend a third immunization. And we can have some discussion about that at the Q&A. But the situation is this. I mean, these are the vaccination rates, and you can see those big light areas are across the South, which is largely unvaccinated, as well as in some of the Mountain West states. And now, of course, we're seeing this as opposed to the Northeast, which is looking really good. And that probably accounts for this big Southern surge that we're seeing now across the South. That's so ominous. And the thing that also concerns me, in addition to the cases of the young adults, we're seeing a lot of children's hospitals fill up, and I've been talking about this on the cable news networks, especially pediatric ICUs, and that's something we hadn't seen before, and that really worries me. The other piece of this is that it's not all COVID. It's also another virus pathogen, respiratory syncytial virus, that we usually don't see over the summer. So there's, whether it was because kids were not in school for a lot, and now they're getting RSV for the first time, I can't really say, but there is this unusual summer surge of RSV. And we're also seeing a fair bit of co-infections, kids with both RSV and COVID-19. So I think the COVID-19 is real, no question about it. And what I'm worried about is schools are opening down in the South pretty early. In Louisiana, they're already opening. Here in Houston Independent School District will open August 23rd. And I'm worried this is going to be an accelerant now for COVID-19. And we also have this terrible situation globally where no one has been vaccinated on the African continent, very few in Latin America, and very few in Southeast Asia. And unless we also address this, we're not going to be able to solve our COVID pandemic. And this will continue to allow variants of concerns to come in. This is what allowed the B.1.1.7 variant, and now the Delta variant. And now there's one in Jacksonville, Florida, that gives me some pause for concern, which doesn't even have a Greek letter name yet, called B.1.621. So it's really important that we commit to vaccinating the world. And it's not just a matter of sharing doses, because there's not enough to share. And I think that's part of the story for low and middle income countries that's not being discussed. Even if the US, I agree that the US can do a better job sharing its stockpile, but the point is, even if they shared the entire stockpile, it wouldn't even be close to the demand, because we've got more than 1 billion people in sub-Saharan Africa, 650 million people in Latin America, 500 million people in the smaller low-income countries of Asia. That's 2 to 3 billion people. We need 5 to 6 billion doses of vaccines, and it's just not been produced yet. And so I've been having a lot of discussions with the Biden administration and others about scaling up production of vaccines that we know we can produce now. And that's where our COVID vaccine comes in. We've developed a sort of old school technology, recombinant protein COVID vaccine that's produced by microbial fermentation and yeast. And the reason that's interesting is because it's the same technology used to make the hepatitis B vaccine that's been around for 4 decades. And there's a great track record of safety. It's even given to infants. And so we have the ability now to scale up that vaccine. So we've partnered with this very interesting organization called PATH. It used to stand for the Program for Appropriate Technology in Health. And they worked previously with the Gates Foundation for the malaria vaccine, for the meningococcal A vaccine. Now they're working with us, and we've now transferred that technology to Biological E, or also known as BioE in India, which is one of the big vaccine producers. They're now scaling it up, and now it's in phase 3 clinical trials with a commitment from the Indian government to produce 300 million doses. And we're also now working with Indonesia to make a halal version of the vaccine, which really does not require many modifications at all. And they can also help scale it up for OIC countries. So what's happening is kind of interesting. We're basically on our own working with other countries to scale up production of our vaccine. And we're happy to do it. We love it. But it's to us, it's a little odd that it's not really being done, in collaboration with the US government. We think the US government should have more involvement. So the vaccine, which the Indians have named Corbevax, the BE for biological E, is the receptor binding domain of the spike protein produced in yeast Pichia pastoris on aluminum hydroxide together with a CpG oligonucleotide from Dynavax. And now it's, we hope, all the stars align, it'll be released soon through emergency use authorization. And what's great about it is there's no upper limit to the amount you can make. So India has the capacity to produce 1.2 billion doses, simple refrigeration, as I say, a 40-year track record of safety based on the recombinant hepatitis B vaccine, potentially suitable for children, even infants, and it's probably the least expensive of all the COVID vaccines. We think it could be done for $1.50 a dose. So, the resources are not really an issue. We just need the commitment from other governments to start scaling. We're discussing it with a number of other low and middle income countries. Now, in parallel, the other hat I wear is, unfortunately, going up against anti-vaccine groups. And this is an interesting history because I'm the parent, in addition to being a vaccine scientist, I'm the parent of 4 adult kids, including Rachel, who has autism and intellectual disability. She's an adult now, and a few years ago, I wrote a book called Vaccines Did Not Cause Rachel's Autism, which made me public enemy number 1 with a lot of the anti-vaccine groups. And so I've had a lot of experience, unfortunately, going up against them, and can share my experiences of what I think is happening right now because of that. And the way I see this is the anti-vaccine movement in the US has morphed or changed over the years. It started out about 20 years ago asserting that vaccines cause autism, and that thread still goes on today, but in a few years back, it took on this political dimension under this banner of health freedom, medical freedom, that linked itself to initially far right-wing extremism, but now it's become more mainstream across conservative groups, and now it's globalized, and that's what we're dealing with now. So let me just briefly take you through version 1.0, 2.0, 3.0, and then we can have some discussion. So first, around vaccines and autism, even within that, it's changed quite a bit. So the initial assertion was that it was the measles, mumps, rubella vaccine that replicated. It was a live virus vaccine that replicated in the colon, and somehow that magically led to autism. So the scientific community responded in a big way, showing that kids who got the MMR vaccine were no more likely to go on the autism spectrum disorder than kids who didn't. And similarly, kids who are on the autism spectrum are no more likely to have gotten MMR than kids who didn't. And then the anti-vaccine groups, which are building forces, then would sort of move the goalposts. As soon as you knock one down, they'd move it again, and they say, okay, well, maybe it's not an MMR vaccine, must be thimerosal preservative in vaccine. And then it moved to spacing vaccines, albumin vaccines. So you're always kind of playing this sort of Pyrrhic game of whack-a-mole, always trying to respond, and then they would move the goalposts. And more recently, they went after the HPV vaccine for cervical cancer and other cancers, claiming it causes infertility or autoimmunity. And if that sounds familiar with COVID-19 vaccines, there's a reason for that. Anti-vaccine groups are lazy, and so whatever worked in the past, they'll just copy paste and glom onto COVID-19 vaccines. And we're dealing with that today. And I got involved because this is me with Rachel, my adult special needs daughter, and wrote the book, and then also spent a lot of time going into detail about what autism is, so we can explain it to audiences. So my wife and I have done a fair bit of outreach about that, and now the anti-vaccine groups call me the original gangster villain because of that. So Brad, you've invited the original gangster villain to speak to your group today. I hope you know that. And one of the things that we do, at Baylor College of Medicine, we have a very strong genetics group. So we've done whole exome sequencing on Rachel and my wife and I. And what whole exome sequencing is, the exons are the 1 to 2% of the genome that encode the proteins, and it's a way to identify new autism genes. And now there's been about 100 genes implicated for autism spectrum disorder. They're all but one expressed in the cortex, expressed in early fetal brain development, involved in gene expression, neuronal communication. A lot of them are involved in excitatory and inhibitory neuronal lineages and synapses. A lot of them are the neuronal cytoskeleton. And Rachel's gene, which was new at the time, is a non-red cell spectrin, a neuronal spectrin, which was published in the American Journal of Medical Genetics. And it's similar, but not quite identical to the 100 genes recently published by the Broad Institute at Harvard MIT. So, we're slowly getting our arms around the basis of autism, and some of the neurobiology and the genetics behind this. Really, really fascinating. And the whole discussion about neurodiversity, I think, is really important as well. And my oldest daughter, Emily, is an assistant professor at UCLA, and really has taken an interest. She's a developmental psychologist now, becoming very interested in the whole basis of neurodiversity. So that in itself is quite an interesting story. But then what happened was, I think maybe we were partially successful at debunking some of this. It was taking oxygen out of the anti-vaccine movement, and they re-energized in a way a few years back that I would not have considered. And that is, what happened was, in Southern California, so many kids were denied access to vaccinations by their parents that there were autism. There was measles outbreaks in Southern California, and this then caused the California legislature to say, "Hey, you know what? This is not such a good idea," and they shut down the non-medical exemption. So it basically said, look, if you want to send your kid to school, you have to get vaccinated. And this ignited version 2.0, the health freedom movement, as they called it. Basically said, hey, you can't tell us to do with anything about our kids. And that's when it sort of glommed on to, at least in Texas, where it really accelerated, to the Republican Tea Party. And the Republican Tea Party became sort of the adopted home of the anti-vaccine movement. These are the number of kids who were opted out by their parents of getting vaccinated in Texas, more than 70,000, and this didn't address any of the homeschooled kids. So, and it was particularly tough in the suburbs of Austin. This became kind of the epicenter of the anti-vaccine movement. And we're dealing with this legacy today under this health freedom, medical freedom, where in 2020, those same anti-vaccine groups then glommed on protests against masks and social distancing, and it became kind of a full-on anti-science movement, which became adopted by conservative groups. And that's why you're getting this situation now where, and it all started a few years ago in Texas, where there is this sharp partisan divide in terms of vaccination rates between the blue states and the red states, unfortunately. So in the Northeast, Vermont, Massachusetts has some of the highest vaccination rates, and our part of the country is some of the lowest vaccination rates, very much along a political divide, which shouldn't be that way. As I often like to point out, there's nothing historically anti-science about the Republican Party. Lincoln launched the National Academy of Sciences, Eisenhower launched NASA, and George W. Bush launched PEPFAR, the President's Emergency Plan for AIDS Relief. This is new and very self-defeating, and trying to, and one of the things that there's no roadmap for is how do you deal with this? How do you de-link the anti-science out of the GOP, out of the Republican Party? And as I say, look, I didn't politicize it. The bad guys politicized it, and my job is to kind of try to de-link it. And so far, I found the only way to talk about it, Brad, is to talk about it. And it's a very uncomfortable discussion, but I think we have to if we're serious about saving lives. And I think the other thing that's happened now is version 3.0. So that same American style anti-vaccine rhetoric has gone global. So we're seeing anti-mask, anti-vaccine rallies in Western Europe, in London, Paris, Berlin. The New York Times, BBC has been reported it's been linked to QAnon and political extremism on the far right, even neo-Nazi groups. So it's taken this very dark turn as a consequence. And And of course, that's not complicated enough. And now we've learned that the Russian government has been using anti-vaccine, anti-science messages as a wedge issue to further divide our country. And this has been reported by U.S. and British intelligence, and it's even got a name to it. It's called weaponized health communication. And this is, so the Russian government has been actively involved in this. And so you've got now this link to far right-wing extremism becoming more mainstream. Second, you have the problem of the Russian government. And third is this one that's been articulated by the Center for Countering Digital Hate. It's amazing. In 2021, we have to have an organization called the Center for Countering Digital Hate, but they're a very interesting group, and they've identified about a dozen organizations they call the Disinformation Dozen. These are non-governmental groups that they say are linked to spreading anti-vaccine misinformation. And so that's kind of the triumvirate. It's this three-headed monster that I've been writing about, which is the US-based anti-vaccine non-governmental groups that have, by some estimates, 58 million followers on social media, far-right extremism and political action committees. This is from an article I wrote in the Daily Beast, and the state actors, especially the Russian government under Putin. So, we've got this situation where this anti-science movement has now gone global, and I argue it's a killer force. And, for things like terrorism or nuclear proliferation, we're willing to put up infrastructure to combat or cyber attacks, but we've not been willing to take this on. And I think we have to give some serious consideration to that. And I've been writing about this in Nature and other science magazines, and it's gotten a very aggressive pushback. It's clearly touched a raw nerve, and that's been a constant challenge as well. So let me stop there, and happy to take questions and however you'd like to proceed.
The old forgetting to unmute my trick on Zoom. That's a classic. Thank you so much for that, Dr. Hotez. So we do have some questions that we already received in advance of your joining us today. But if anyone out there watching does have a question during this Facebook Live, you can write that question in the comments and we'll get to as many as we can today. So let's start off with, the last topic we were talking about there with the Disinformation Dozen, with the political divide that we're seeing in vaccination efforts. This is no easy problem to solve, and talking about it is a great first step. But what do you think is the plan? What do you think is the way that we can break down this divide? And I realize that is no easy question to answer.
So I'm glad you asked that. And I think part of the problem has been the Health and Human Services agencies for many years has taken this approach, which I've disagreed with. And they've said, whenever I would write about this, I wrote an article in the New York Times in 2017, how the anti-vaxxers are winning. And I got a lot of pushback from the CDC and Health and Human Services Agency. And it went something like this. He goes, Peter, we're not going to talk about this now, because if you talk about it, it'll give it oxygen. And I'm like, this thing's got all the oxygen it needs. It's on fire, and we've got to address it. And so for years and years, and I think there's been this enabling factor coming from the US government that sort of clung to this idea from 20 years ago that says we're not going to talk about it. And that had an enabling quality. And even now, the Surgeon General, was the first, Vivek Murthy is the first Surgeon General to say this is a problem. But his report, I think, fell far short of what we need. And I've told him that. I think he's a wonderful guy. He's a really good Surgeon General. But I've said, it's not enough. I mean, they're pointing fingers at Facebook. And I said, well, Facebook, true, it's one of the disseminators, but what? So is Amazon. Amazon is the single largest promoter of fake anti-vaccine books. I mean, you can do this at home. If you go to Amazon.com, as everyone has done, and put books up at the top, press return, you'll get the scroll down menu at the left. You go to health, fitness, and dieting, click on that, you'll get the books on vaccinations. It's all fake anti-vaccine COVID conspiracy books. So it's not just them. So the problem is that this refusal to go to the source. And that's tough, right? Because, what are our options? And so here's what I've said. I've said, look, I think the health sector, people like myself, we don't know what to do because that's not our training. I've said what I've asked the Biden administration to do is put together an interagency task force to bring in the experts from Homeland Security and Commerce and the Justice Department and State Department to get better understand what are the levers we can pull and push to basically dismantle or the monster, the empire. Otherwise, this thing is going to continue, and we have to do it because of the deadly consequences. As I like to point out, 614,000 Americans, yes, they died of COVID, but that was only partly due to the SARS-2 coronavirus, an equal measure defiance over masks and social distancing, now vaccines. So I've written articles with the very provocative title, Anti-Science Kills, to put it out there. And it's absolutely true. And we just haven't had the commitment and energy to really want to take on the monster.
And one more question of my own before we get into some of the questions that we received from our audience. So we've seen a lot of pushback, a lot of hesitance in vaccination and in everyday practices you can take, with masks being a prime example, to prevent transmission. And we hear now about monoclonal antibody therapy to treat patients with COVID-19. Has this been something that you've seen similar pushback as we see in vaccines and other areas of this arena?
Not as much. I mean, there's been a lot of defiance of vaccines, but then when people get sick, they say, "Oh my God, this thing is real," and then they want treatment. And the problem with monoclonal antibodies is they can work, although maybe not as well against Delta, but you have to give them really early on in the course of the illness. Once you allow the virus to take hold and set off the inflammatory response to monoclonal antibodies, it's too little, too late. So that's been the challenge, is getting monoclonal antibodies early enough. And I think, from the therapeutic perspective, we've been too restrictive on who gets it. And so there's a lot of monoclonal antibody going unused as well. I think we could be a little more liberal about that. And the other problem, of course, it's not user-friendly or easy to administer, right? It requires going to an intravenous center, requires intravenous infusion, which is doable, of course, but it's not something you can do at home, or a physician writes a prescription, you get it filled at the pharmacy. You have to go to an infusion center.
Okay. So these questions came from audience members in advance. And if you have questions of your own for Dr. Hotez, go ahead and make a comment here on Facebook Live, and we'll get to as many as we can. So this first question is one that we hear a lot, but I think it's one that we can stand to hear the answer to, as many times as possible. What measures or tests were taken during the decades the mRNA technology was developed to ensure it was safe for humans? So how do we know these vaccines are safe?
Well, first of all, as I like to point out, delivering the spike protein, we've been doing that for 10 years. And so I think part of the problem is there's this myth out there that the mRNA vaccines popped up overnight. And I know why. It's in part the fault of the company CEOs. When they send out a shareholders press release, it's not meant for you or for me, it's meant for the shareholders. And they tend to spectacularize their accomplishment, kind of tone deaf to what the impact would be on public health and perception. And that caused a lot of damage. So the truth is, coronavirus vaccines have been under development for at least a decade, arguably even longer than that, as is the mRNA technology. If you look at the first paper showing mRNA can induce an immune response, it goes back to 1961. So this is not as new as we think. I think the problem has been on the delivery of mRNA. And for years, the situation, both with RNA and DNA vaccines, has been they worked really well in mice, but when we tried to reproduce the immune response in people, it was never quite as robust. And so there needed to be refinements and improvements in the delivery. But and it's worked spectacularly well. And I've gotten 2 doses of the Pfizer BioNTech vaccine. I think part of the problem is it was tarnished by by one of the company press releases, and then it was exploited by the bad guys, by the anti-vaccine groups, who then look for any weakness they can on public perception and jack it up. So in this case, they said, well, the mRNA vaccines are not really vaccines, they're gene therapy, which is nonsense because they don't go into the DNA, they don't go into the nucleus. This is why we need the Carnegie Center, right, to explain to the American people that a cell has a nucleus and has cytoplasm, and the RNA is in the cytoplasm and made into protein in the cytoplasm, and make up for the deficiencies that people have come away with without high school biology. And so this is why when Steve Knapp, who was my president at George Washington University, told me that he'd gone over to the Carnegie, I actually practically invited myself, Brad. I said, I really want to talk to you guys because what you do is so critically important. You have no idea how important what your mission is in terms of getting science to the public. We don't do that as scientists. We don't do nearly a good enough job at that, and that's really critical. So now I forgot what I was even talking about, but the point is that one of the talking points is that it's gene therapy. It's not gene therapy, or they even have come up with this term genetically modified humans, right? Which is just they took the GMO and they added H instead of O. Now we're genetically modified humans. It's absolute nonsense. Or they'll say it causes infertility, and that's what they got from the HPV vaccine. They copy pasted, no evidence for it, not even any plausibility. Or, and the list goes on. And this is part of the exhausting problem, because that in itself is a game of whack-a-mole. You knock something down, then they'll pop up another assertion. And this is why I'm often asked, hey, isn't the problem that the vaccines haven't been formally approved? And that then everyone will come running. I said, well, no, not really. I mean, that's just one of many talking points. And yes, it'll help. And yes, we should take that off the table and get the vaccines approved. But don't expect all of a sudden the floodgates are going to open and everyone's going to be vaccinated. The anti-vaccine groups are still too deeply dug in and still dominate the internet.
Right. And, we see a lot of plays on emotions. If you're a parent and you hear that there's a possibility that a vaccine could affect your child's fertility down the road, you might be much more disinclined.
Absolutely. And especially if I remember when you're downloading, go to your search engine, download stuff on mRNA vaccines, you're more likely to get garbage than the real stuff. And the problem now is we're seeing here in the South, we're seeing lots of adolescents get sick. I mean, this is serious business with Delta. And I'm really worried when schools open, this is only going to accelerate more. And we're seeing so many kids now, a lot of teenagers especially, getting sick, and the vaccination rates are just ridiculously low among adolescents here in the South. As I said, 20-25%, so the vast majority are not vaccinated. So if we're going to get through a school year, we've got to get the adolescents vaccinated to keep the middle schools and high schools safe. And then that has the collateral benefit. If all of the adolescents are vaccinated, all of the adults, that has the collateral benefit of reducing community transmission and spread. So it protects the little kids as well.
Great. And speaking of children, do we see that the Delta variant has more severe symptoms, more severe cases of COVID-19 in those young populations?
Well, no question, we're seeing a lot more young people get sick than ever before. But I don't know how much of that is because this Delta variant is so much more transmissible. So it's basically picking off anyone who's unvaccinated. And when you get that many infected, you're going to get a certain number that are going to get seriously ill. So I don't know I can't say at this point whether this virus is targeting adolescents and kids or specifically, or whether there's just a firestorm underway in the South and it's sweeping up all of the adolescents and and kids with it. And we probably won't be able to sort that out for some time, but it's clearly a wake-up call that we've got to get young people vaccinated.
And staying on the topic of young people here, being that the Delta variant is so highly transmissible, and we hear about breakthrough cases, with vaccinated adults might contract COVID-19 even though they're vaccinated. How risky, how much should vaccinated parents be worrying about the possibility of transmitting some Delta variant that might be carrying to an unvaccinated child?
Yeah, so I get asked this a lot, and this is the toughest one to answer, not because it's tough to answer, but it takes 5 minutes to answer. And you don't get 5 minutes often on a cable news interview. So, but I think it's very important, and I think it's useful. So when these vaccines were first released for emergency use, it was based on the fact that they were 95% protective against symptomatic illness. In other words, all the clinical trials were done looking for symptomatic illness and serious hospitalizations and that sort of thing. And they were high-performing vaccines. And everyone was really excited. Later, it came out as these vaccines began to be widely used in Israel and the UK. Studies after they were released for emergency use showed, hey, they're also working to halt asymptomatic infection. In other words, the virus neutralizing antibodies are getting into your nasal secretions and your mouth and your saliva and stopping the shedding of virus. So that meant you were stopping asymptomatic transmission, or even if you got a breakthrough infection, you weren't going to transmit it. So that was really exciting. I thought, wow, that means we can vaccinate our way out of this epidemic, if everybody gets vaccinated. The problem is, we didn't do as good a job vaccinating the population. This allowed this Delta variant to emerge in India, and then it came into the UK and the US. And the problem with the Delta variant is it replicates in much higher amounts in your nose and mouth than anything we've seen before, and that may be why it's so transmissible. And the problem is, even with your virus neutralizing antibodies in the vaccine, I think of it as like an arms race between the antibody in your nasal secretions and that large amount of virus from Delta. And so in the first couple of days of the illness, you're still shedding a lot of virus if you get asymptomatically infected. I think, though, what happens is then, the antibodies rev up, and that actually halts transmission subsequently. So I think, we kind of went from it's working great against asymptomatic infection to it's not working at all. Now I think we're somewhere in between, in that I think what happens is, if you're vaccinated and you get exposed to Delta and you get a breakthrough asymptomatic infection, you're shedding virus, but probably just for the first day or so. And then I think it starts going way down. Now, that has not been proven yet. I think that's a story that we're probably emerging. But the message is, it's clearly the unvaccinated who are still responsible for the vast amount of asymptomatic transmission.
Okay, thank you.
And hopefully I've not thoroughly confused you. So, but you can see it's not a 30-second UNICEF commercial.
Right.
It takes time to articulate it all.
Which is probably why it's so easy for misinformation to spread, because it's short, it's a soundbite, it's a snippet.
Yeah, and then the anti-vaccine groups say, "Hey, see, I told you the vaccines aren't working, right?" So
yeah, to really paraphrase poorly, a lie can run around the earth while the truth is still putting on its shoes.
Yeah, absolutely, absolutely.
So we have time for just a couple more questions here, looking at the clock. One question from an audience member is, are there other health conditions that are impacted with the misinformation campaigns that we see, aside from vaccination efforts and COVID-19? Are we seeing this in a wider part of our health communication?
Well, here's what I'm worried about is, with all the social disruption from COVID, clearly all of our vaccination programs took a hit. Flu vaccinations, I think pediatric childhood immunizations took a hit. HPV vaccinations took a hit. And now they're slowly coming back up, but I worry that the anti-vaccine groups have become so powerful that there's going to be collateral damage and that we're not going to be able to return to baseline. We're already starting to see that with HPV vaccine. So I am quite concerned about it. And it's not just happening in the US, I think it's happening globally. So I think all of our global vaccination programs have probably took a pretty serious hit. And it's going to take a lot of advocacy and effort and countering the anti-vaccine groups to kind of get it back.
Thank you. And we have another question from our live audience. The question is, and it's probably one that we hear very frequently, is, how long do we anticipate that these vaccines are going to be effective? Are we thinking that boosters might be required?
I've always been saying all along that boosters will be required. Most of our vaccines are 3-dose vaccines or 4-dose vaccines. So I do not think we're going to need to get vaccinated every year, but I would think a third immunization at some point down the line will be necessary to create greater durability of protection, to elevate our virus neutralizing antibodies even more, and that'll build in greater resilience against the variants. I think what I got thrown by, and a number of us did, was yes, we've been saying later on in the year, next year, we'll anticipate getting a booster. And then the Pfizer CEO came out with a press release again, and that said, no, we need to do this now for Delta, and didn't provide the supporting information for it. So I think that kind of threw us all. And this is why we don't like doing science by press release, right? Because there's not the data, at least publicly available data, to support this. And I just wrote about this in the Daily Beast yesterday. It just came out, so you might want to take a look at it. It basically says, are you confused about third immunizations for COVID vaccines? Well, you should be, because trying to sort the difference between waning immunity and Delta and company press releases, it makes people crazy. I think what's probably going to happen is word will come out soon for those around immunosuppressive therapy. They clearly are not responding well often to 2 doses, and we'll probably need a 3rd dose for that group. I think the only question mark is in Israel now. They've also released it for people over the age of 60 for a 3rd immunization. Whether we'll do that in the United States, and I don't know what the companies are presenting to the FDA and CDC and how they're looking at it.
Great. One last question here, because as you mentioned writing and all these articles and TV appearances, you do have a TV appearance coming up right after this, so we want to.
Well, I'm supposed to go on CNN, but I just got a note that Governor Cuomo has resigned, so I'm wondering if that might preempt things, but we'll see. Who knows?
A bump is possible, but still, we'll respect your time and get wrapped up here. And this question is: let's say you get infected by COVID, you test positive. Is there any way to know which variant you contracted?
Well, in theory, you could, right? In theory, you could grow up the virus and do genomic sequencing, but at a practical level, no. But right now, pretty much everything's all Delta right now, and I think it'll be Delta for the foreseeable future. There are other variants looming out there that may outcompete, but right now, Delta is the mother load of all the variants.
All right. And aside from the masking, the hand washing, the distancing, are there any other steps people should take to protect themselves from the Delta variant?
Well, obviously, making sure you're fully vaccinated, fully up, both doses, or if you got the J&J, make sure you've gotten that, and be mindful and have situational awareness about whether there's going to be a need for a second J&J vaccination, immunization, or a third, and I think that's what's going to come down as well. And then, understand the level of transmission in your community. So, for instance, if I'm in Vermont, where transmission's really way down, I might act differently than I do in Houston. So in Houston a few weeks ago, I don't really go to stores much anyway, but if I did, I would wear a mask when I would go into a store. When I come into work, right now I'm closing the door and doing Zoom calls, but if I'm walking the halls, I would wear a mask. The only time I wouldn't wear a mask is with my youngest son and his girlfriend. If we take them out for dinner, right, wouldn't wear on the weekend. We wouldn't wear a mask. Now, with all this transmission going back up again, I'm not so sure. So we're looking at going back to DoorDash for a while, I think. And so, but I might think differently if I'm in Pittsburgh, where there's not that same level of community transmission. So I know that's frustrating to people because they say, well, how do, as a layperson, how do I know what's what? And what I've recommended to the CDC is they put together a force of infection map so people can get a better sense of where they are in the US and what their risk is. And the CDC doesn't like to do that. They like to simplify things, do one size fits all. But I think for this kind of illness right now, which has such profound regional differences, I think that's warranted.
Great. Dr. Hotez, I want to thank you so much for taking the time to enlighten us today and take these questions from our audience. We truly appreciate you being here and being a great trumpeter of science for the public. So thank you for your work in that front as well.
Thanks so much. And again, thank you for all your great work and your important work, and anything I can do for the organization, just let me know.
Thank you. And while Dr. Hotez is signing off, I'd like to let everyone here know that if you would like to learn more about viruses and how we can be creative in fighting them, you can join us this Saturday, August 14th at Carnegie Science Center for SARS Saturday, Chasing COVID, where you can talk with local experts, virologists, and answer any other questions that you have. Dr. Hotez, thank you again. And everyone out there, have a wonderful day.
Bye-bye.